My name is Tessa. I'm a midwife on the postnatal ward here in Letterkenny. I would like to speak to you about how to position your baby safely and comfortable for sleep. To begin with, it is important to know that it is recommended that your baby should sleep in a Moses basket or a cot in the same room as you for at least the first 6 months of life. When you're putting your baby to sleep, they should always be positioned on the back to sleep. They should not be put to sleep on their side or their tummy, as this increases the risk of sudden infant death syndrome, otherwise known as cot death. Babies should be positioned feet to foot, so their feet are positioned at the end of the cot and there is lots of room for their arms at the top. The blankets we recommend are the cellular blankets. These blankets have little holes in them, so if the baby did kick the blanket over their head, they would still be able to breathe. We recommend 2 of these cellular blankets folded in 2. It is important that the rest of the cot is kept clear. There should be no bumpers, pillows or teddies in your baby's sleeping area. When placing baby down, put the blanket at nipple level on the baby with the arms out and tuck the blanket into the mattress. This should prevent the baby from pulling or kicking the blanket over their head. The ideal room temperature is between 16 to 20 degrees. Some parents like to buy a thermometer so they can check the room temperature. Babies regulate heat through their heads, so there is no need for a baby to have a hat on whilst they're sleeping. The cot should not be beside a radiator, and please do not use a hot water bottle or electric blanket anywhere near your baby. If you wish to check your baby's temperature, please do not use the hands or feet as a guide, as they will be cooler than the core of the body. To check the temperature, simply pop your hand onto the chest or the baby's back. If this feels too cold, pop on a layer, and if it feels too hot, remove a layer. By following these tips, you can be confident that you are keeping your baby safe and comfortable. Remember, back to sleep, feet to foot.